Welcome to another edition, this time psychology in my basement. Woo! Today we are continuing with Unit 13, which deals with the treatment of mental illness. And today's focus is going to be on biomedical therapies. So, in our last session, we talked about psychotherapy and different ways that you would conduct psychotherapy, which is also known as talk therapy. So, you have a psychologist, psychiatrist, a counselor who's talking one on one with a client or patient, talking about their health history and the problems that they're experiencing. But today we are looking more at the biological aspects of treatment, and that's where we look at our biomedical therapies. Now, our number one biomedical therapy that we would, I have to make myself smaller, that we would utilize is known as psychopharmacology. So, psychopharmacology is where we are going to study the effects of drugs on the mind and subsequently on behavior, and how can we use pharmaceuticals as a way to help individuals with mental illness kind of mitigate the symptoms that they are experiencing. So, we're going to look at some of the major types of drugs that are used for some of our biggest or most severe types of mental illnesses that people experience. You should know, of course, that if you feel as though you're experiencing symptoms of mental illness, that this is the kind of conversation that you would have with your healthcare provider about what kind of medication would best suit your experiences and what's happening in your lifetime. Because pharmaceuticals, like any type of drug that we might take for heartburn or headaches, that there's going to have some potential side effects that we need to consider. So today we're looking at these different biomedical therapies, but more specifically looking at psychopharmacology. So one of the first types of drugs that was created in order to, let me back up the train. It should be noted that throughout history, our treatment of mental illness has varied widely, in that you might consider it to be torturous in what it is that we've done to people, locking people away. But the idea of like herbal remedies or using different types of plants and things like that to to help us. I mean, that's been a basis of medicine. And so this concept of using drugs to treat mental illness really isn't as new. It's just that we used to do it for a really long time and then we moved away from it. And now, starting in about like the 1950s into the 1960s, we really started to look at different kinds of medications that we could utilize to help those with mental illness. And the big one that began in all of this are what is known as our antipsychotic drugs. So an antipsychotic drug is, I'm sorry, it's freezing in my basement. That's why I've got my blanket on. And that's our sump pump in case my basement were to flood. So antipsychotic drugs are specifically created to treat those who are experiencing symptoms of schizophrenia. That's why they're referred to as antipsychotic. And anti being, I'm trying to stop the psychosis that is associated more specifically with schizophrenia. However, antipsychotic drugs might also be prescribed for people who experience symptoms of bipolar disorder as well, because of the manic episodes that can occur in bipolar disorder. So we have our first type of antipsychotic drug that was created is a drug known as thorazine. And thorazine came on the market specifically to help those who are experiencing positive symptoms of schizophrenia. So more specifically, those auditory hallucinations, as well as the delusional thinking patterns. A second type of antipsychotic drug that was created is something known as clozapine or clozaril. And that was supposed to be made for those negative symptoms of schizophrenia, so that reanimation that would need to happen in patients who have those negative symptoms of like apathy, withdrawal, kind of reclusing into themselves. However, Both of these drugs have some pretty major side effects based on how they are going to work. So we know, of course, that in schizophrenia, people generally are experiencing an excessive amount of the neurotransmitter dopamine. So there's too much dopamine that's being produced in their bodies. And so the obvious thing that we would do to treat this is to reduce the amount of dopamine that's available in the brain. But of course, we know that dopamine is responsible for making us feel good, and that these are going to be drugs that are purposefully going to uh, reduce those good feelings. And so, a big problem that's going to happen with any of our antipsychotic drugs is that they have potential of making the persons who use these drugs feel really horrible. And so, symptoms of, I might not have delusions and hallucinations, but I might start experiencing symptoms of depression, for example. I might have suicidal ideation. That obviously is going to be a negative side effect that happens from thorazine as well as clozapine. However, thorazine and clozapine work by targeting different dopamine receptor sites. So thorazine is specifically targeting what's known as a D2 receptor site, a dopamine 2 receptor site. And this new generation antipsychotic, the clozapine, targets a D1 receptor site. So they're targeting different receptor sites in the brain, but still dealing with dopamine. Now, one of the more significant types of side effects that can happen with thorazine is that it can create um, a type of um, side effect that we know as, hold on, it's right here, tardive dyskinesia, okay, which is involuntary muscle spasms of the face, neck, and head. So it's typically in this general region, and it looks sort of like the tics that you would expect in somebody who's experiencing Tourette's syndrome. But this is because of the use of the drug, and it doesn't go away. So even if I have stopped taking my antipsychotic medications, I might have this involuntary muscle spasm for the rest of my life. Now, in an assignment that I'm going to be giving students on PBS Frontline's The Medicated Child, you will notice that one of the persons who's featured in that documentary is experiencing tardive dyskinesia, and it is because of the use of antipsychotics. Now, our new generation antipsychotics, that clozapine clozaril type of drug, because it's targeting a different type of dopamine, it's going to be more responsible for issues with eating. More specifically, that people who take this drug will develop insatiable hunger. So it's really affecting the hypothalamus, and that hypothalamus telling me that I'm full and that I don't need to eat anymore. Those messages aren't happening because of this drug. And so you'll get somebody who's going to eat and eat and eat and eat and eat. Their body's never telling them that they're full, they're not hungry anymore. Like, that's not happening. And so there's major problems with obesity as well as diabetes that can happen because of this antipsychotic drug. Again, in that PBS Frontline documentary that I'm posting, it's called The Medicated Child, another character that's featured in the documentary is going to be experiencing this kind of side effect. So side effects are going to be a big problem that is associated with any kind of drug, just like your headache medicines and heartburn medicines and things like that as well. So the next major type of drugs that we look at, interestingly enough, remember how I said that, for a long time we've looked at different medications and how they can help people. A simple salt known as lithium has actually been prescribed to people who experience bipolar disorder, and that it can help stabilize those mood swings that can happen in bipolar, where I have those distinct periods of depression for 2 weeks followed by distinct periods of mania. Some of our really big types of antipsychotics are going to be not antipsychotics, our pharmaceuticals are going to be our anti-anxiety drugs. And your big anti-anxiety drugs are going to include things like Xanax and Ativan. So an anti-anxiety drug, because we know that in anxiety disorders, that parasympathetic nervous system isn't kicking in the way that it's supposed to be. It's not calming me down the way that I would want it to. That with these types of drugs, they are going to be depressants. And so they are specifically depressing the overall central nervous system, so throughout my entire body, and that it's going to help relax the body and calm this person down. Now, anti-anxiety medications can be very effective, especially in people who are not able to pinpoint their exact cause of anxiety. So like what we might see in persons with like a generalized anxiety disorder, for example, where their body is just kind of always in that hyped up state, that this kind of a pharmaceutical might be a really great option for them in managing their symptoms, because they don't have a specific trigger. They're just always in this anxious state. The major problem, of course, with our anti-anxiety medications, however, is that because it is a depressant, people will often utilize other types of depressants and not realize the major side effects that it can happen, because the big side effect, of course, is going to be death. So, for example, if I'm taking an anti-anxiety medication, but then I consume alcohol, well, I've just given myself a double whammy of a depressant that could make my heart stop. And that's where we start looking at that accidental overdose that happens, where a person was combining their their prescribed medication with something like alcohol. And this is a really common occurrence, unfortunately. So people really have to be aware of what can happen when they're utilizing these medications. They can be very, very effective, but they need to be used appropriately. And so that's another major side effect that can happen with our anti-anxiety medications. Now, the type of medication that kind of made, I don't know how to explain it. So in the United States, I think there's always been this stigma about mental illness, and there's still a stigma about mental illness. It's something we've talked about in class before. But the pharmaceutical that really kind of changed a lot of attitudes in the United States about mental illness is actually our antidepressants. Antidepressants are going to be a type of pharmaceutical that's lifting a person up out of their experiences of depression. So when we talked about depression, like major depressive disorder, and how it's that cycle that I go from being okay and I'm descending further into my state of depression and then I'm going to come back up again, that, you know, depression is a cycle, and that for many people, regardless if they have treatment or not, they're going to be able to come out of that cycle. But medications make that cycle much shorter and make it much more likely that this person is going to overcome their symptoms of depression much faster. And antidepressants help with that, because we know that in many people who are experiencing symptoms of depression, there is not enough of the neurotransmitter serotonin. So serotonin is a type of neurotransmitter that deals with things like my alertness, as well as making me feel normal, making me feel stable, making me feel like everything's okay. So we talk about it with things like learning, like it's there when I'm learning, when I'm engaged in something, when I'm paying attention to something. It has to do with that energy level. And, you know, in people who have depression, there's always that major aspect of lethargy. You know, we talked about how a lot of people think that depression is sadness, but a lot of times it's actually more of that lethargy that can happen. So our antidepressants are going to work by increasing the amount of serotonin that is going to be available in the brain. And the first major type of drug that was available to do that is a drug known as Prozac. And Prozac is still available, but newer types of antidepressants that are becoming available are actually known as dual action antidepressants, or they're called SSRIs. SSRIs, right down here. SSRI is going to stand for selective serotonin reuptake inhibitor. So SSRI, selective serotonin reuptake inhibitor. And that's going to work in two ways. So one, it's going to make more serotonin available in the brain, but it's doing that by blocking the reuptake of serotonin. So when we talked about neurons and how neurons work, a little review for you, that we mentioned how you have that axon terminal and that those neurotransmitters are going to leave the axon terminal. They're going to move into the synapse. They're going to bind themselves on receptor sites of a receiving neuron. And that when there's not enough receptor sites, those extra neurotransmitters go back up into the sending neuron into that into that axon terminal, and that they're going to wait for the next action potential to come along. Well, in SSRIs, because I'm blocking reuptake, I've got all these serotonin molecules that are hanging out in the synapse. And so instead of waiting for another action potential to come along, as soon as those receptor sites open up, I have somewhere to bind to. I'm going to create a brand new action potential that wasn't there before. That's going to help re-energize me. It's going to make more of that serotonin available. And SSRIs also typically involve norepinephrine as well. So again, an excitatory, something that's going to help stabilize my overall mood and behavior, and making me feel better and making me feel more energized. So our antidepressants are incredibly common types of pharmaceuticals that people utilize. Um, with any type of pharmaceutical that is used in mental illness, it's often going to be a game determining how much of a particular pharmaceutical a person is going to require, right? So there's a lot of trial and error that can happen with these pharmaceuticals, looking at how much dosage, the frequency, how many milligrams, things like that. And so it can be quite a tedious process for people to um, figure out what is the best kind of combination of medications as well as other types of therapies that they might utilize in order to help them manage and mitigate those kinds of experiences they're having related to their mental illness. So while we do have these types of pharmaceuticals, biomedical therapies are looking at other ways that I might go about helping those with mental illness. And this is where we're getting into kind of more of a historical aspect. We don't necessarily use these types of therapies anymore like we used to. But probably one of the more notorious types of biomedical therapies that is still sometimes used today is something known as ECT, or electroconvulsive therapy, which you might know as being shock therapy. So the idea was that you would go to something that like electricity in order to create convulsions that would help stabilize a person's experience with mental illness. And so the idea in its infancy was to actually, they didn't use electricity in the beginning. They used other types of medications and things like that, and there was not always positive results. Um, but with shock treatment, and it was also used for schizophrenia in the beginning, which doesn't really do anything for schizophrenia, but it was found that it can actually be really helpful for people who are experiencing depression. And so what we see happening is that people with depression, where they're experiencing that lethargy, that lack of energy that's happening, by creating an electrical charge, very similar to how we would use like the defibrillator on the heart to like restart a heart up, that you're using it on the brain and like to re-energize the brain, and that it can actually be beneficial, that it's not a painful experience for someone, but there's a lot of apprehension that can come from having electrodes being placed on your head to re-energize the brain. But unfortunately, the big problem with ECT is that even though we do know that it's beneficial to people with depression, is that it has been significantly abused. That especially when you looked at like your old school mental hospitals, those kinds of facilities that don't really exist anymore as they did, that shock treatment was often used as like a source of punishment. So like a person who misbehaved or something like that, that they're going to be wheeled in and have so many shock treatments, and that it's something that shouldn't be used all the time. And then you were getting these patients who were being shocked hundreds of times, in while they're there, and that was just becoming really abusive. So when we introduced pharmaceuticals, we really did start moving away from something like ECT, which even though it can be helpful, it's not necessarily going to be our best option depending on our types of experiences. But probably the most notorious of biomedical therapies that has ever existed is the lobotomy. So, a little history on the lobotomy and exactly what it is. So, a lobotomy is where you are detaching the frontal lobe from the rest of the lobes of the brain. And the idea was that you could better control behavior. You wouldn't have these strong emotional outbursts and things like that by detaching the frontal lobe. This was a process that was created by a Portuguese neurologist named Egas Moniz. And Egas Moniz actually won the Nobel Prize in Medicine in 1949 specifically for the lobotomy, which probably sounds really strange because, today lobotomy is this kind of notorious, horrific surgery that people experienced. So Egas Moniz actually did his surgery by placing a scalpel about here-ish on either side and would meticulously work to sever the frontal lobe from the rest of the brain. And this was a pretty tedious kind of process, and that he did see some success in helping to calm down patients who were experiencing violent outbursts and things like that in mental health facilities. But there was a big problem that was happening throughout the world. So if you look at the time period 1949, if you know your history, you know that a few years earlier, the world was gripped by World War II, and that war is going to create major mental illness problems, especially in things like post-traumatic stress disorder and other types of anxiety disorders and depression. And so, being this kind of traumatic experience, if somebody was going to develop schizophrenia and they have this trauma, they have paranoid schizophrenia. So, especially in the United States, these mental hospitals that we had are becoming overflowing with these casualties of war, these mental casualties of war. And the idea of the lobotomy was an easier way to treat those with mental illness. So in walks an American doctor by the name of Walter Freeman. Walter Freeman reads up on Egas Moniz's lobotomy surgery. He thinks like this is what we can do. This is something that the United States can definitely pioneer. But he wants to do it a different way. And so he creates a much faster and therefore much cheaper technique of performing a lobotomy. And his is known as a transorbital or ice pick lobotomy. So where Egas Moniz took a scalpel from either side of the brain here, this is where Walter Freeman would go through the eye socket, and he would use an instrument that very much resembled an ice pick that you would use to chip away at ice or to hook onto ice. And he basically moved this is going to sound disgusting. So, if you can't handle it, well off for a minute. But what he did was he would move the eyeball over and he'd go beyond the eyeball and, kind of do like a chink, chink into the eye, and it would disconnect the frontal lobe from the rest of the brain. And so it worked in that it was, detaching the frontal lobe. However, as you can imagine, once it started becoming really popular and that there were thousands of people, especially in the United States, who were undergoing these surgeries, people weren't really okay with the idea that this is how we were going about and treating those with mental illness. Probably one of the most notorious persons who ended up being lobotomized is a woman by the name of Rosemary Kennedy. Now, Rosemary Kennedy is the younger sister of our own John F. Kennedy, who was President of the United States. So JFK, large Catholic family, his older brother was actually being groomed to be president, and yet he dies in World War II. And so John F. Kennedy actually ends up becoming president. His younger brother, Bobby Kennedy, is, of course, his Secretary of State, and then he was running for president as well until he was assassinated in 1968. And they also had some sisters. And one of those sisters is Rosemary Kennedy. And kind of like her brothers in a way, she's a little, how do I want to say it? She's a little feisty. She likes to party a little bit, okay? And the patriarch of the family decides that, she might actually be a liability, a political liability. And so a way of dealing with Rosemary is that she is uh, put into a mental hospital and she is lobotomized when she is in her early 20s. There's a lot of debate as to whether or not she actually had mental illness. Many people are going to argue that she did not. But because of laws at the time being much different than they are today, those rights that she may have had, they didn't exist in this time period. So her sister Kennedy, Eunice Kennedy is actually the mother of Maria Shriver, who Maria Shriver was married to Arnold Schwarzenegger for a period. Eunice Kennedy actually went on to develop the Special Olympics. And many of you are probably familiar with the Special Olympics and its goals and things like that. And she created the Special Olympics in honor of her sister Rosemary. Rosemary did survive her lobotomy, but she lived out the rest of her life in private healthcare facilities where she was really unable to care for herself. Because while lobotomies were successful in making it where a person wasn't as agitated, they wouldn't be as violent or angry or uncontrollable in that way, they also in many ways became vegetables and not able to care for themselves, not being able to live a normal and healthy life afterwards. And so once people really found out, especially about Rosemary Kennedy being lobotomized, lobotomies really fell out of favor. And this kind of coincided with the time that pharmaceuticals like Thorazine as an antipsychotic kind of started coming onto the market. And so that's where you're going to start seeing that major shift in history from the biomedical therapies being that of surgery or something like electroconvulsive therapy to being the use of medications in treating mental illness. So those are your biomedical therapies to talk about with treatment of mental illness. Again, it's always important to note that there is no one single way of going about and treating mental illness. There's no easy, one size fits all type of treatment. Every person is different. Everybody's symptoms are going to be different. And so combinations of psychotherapy and psychopharmacology are often the ways that we go about treating mental illness. And of course, if you think that you're experiencing symptoms of mental illness, it's very important that you talk to your healthcare provider about what your experiences are and what kind of treatment may be available to you. So I hope you all have an excellent day. Until next time, this has been Psychology in my basement.